My name's Hitesh Panchal. I've been a dentist for the last 12 years. Predominantly been a general dental practitioner. I recently opened my own practice based in the heart of Salford Quays, where we see a wide range of patients and do a lot of treatments at our centre. Hello there, very nice to meet you. If you'd like to follow me. General British dental oral condition isn't regarded as the greatest care. Prevention is better than cure, and unfortunately we are the RAC for some population of the public. However, there is a growing population now who are understanding that just like their pride and joy of their expensive car, it does need to be maintained and serviced regularly, and by doing that regular service and maintenance, they're less likely to overcome or have any major problems in the future. Head and neck cancer was brought to our attention in our undergraduate training. Albeit it was only a very small module, it did bring to light that although one of our roles, not only to repair and fill teeth, was to look at other conditions which could detrimentally affect someone's health, and oral cancer being one of the ones which we were told to look at. During that time, it was always expressed to us that you may experience it once in your career, but as things are going now, the chances of you witnessing or seeing a lesion which may turn into cancer is becoming more and more frequent. So it's more and more important now that the dentist is really familiar with what they should be looking out for and what to refer as soon as they can. The dentist is the only person that looks inside your mouth, and it's important for them to check and get the early diagnosis as soon as possible to increase the chances of survival. So when the patient comes into us, we'll do what's known as an oral cancer screen. It's a very simple, quick procedure that we do. The signs that we look for when we look in the mouth can vary. We're looking for changes of colour, changes of texture. We're looking for any redness or soreness around the mouth. And we're looking at all the surfaces, from the lips to the inside surfaces of your mouth, to your tongue, to the roof of your mouth, and also the floor of your mouth. And also going right back to the back of your mouth as well. We also look around your neck as well and feel for any lumps and bumps around those areas, and make sure nothing's been there for longer than 2 weeks. We keep the procedure very, very simple, so you don't need specialist equipment, because we want to be able to do the examination with the instruments you have on your chair, so that there's no additional things that you need to get out, and it's done there and then as part of your normal examination. If we do notice a suspicious lesion, we will then refer to the local head and neck cancer department. They will then do their follow-up appointments, which is usually a biopsy or some more investigations on the suspicious lesion, and from that they will get a diagnosis, and if it does unfortunately proceed to anything, they will then take on the treatment from there. So I don't want people to get worried that if someone notes a sore or an ulcer, doesn't necessarily mean that is oral cancer or anything that will lead to that. But the dentist won't be sure, so the dentist, what we'll do is send on a referral to get a diagnosis from someone specialist in the hospital, just to confirm that it's nothing to worry about. The high risk groups are generally the people age over 40, but most commonly it's smokers such as cigarette smokers, tobacco chewers. You've also got things like pan chewing and betel nut chewing, which are sometimes social habits seen in the Asian communities. Also people who have excessive alcohol use are very high risk, especially those who smoke and have alcohol. There is a much greater chance of seeing oral cancer developing in those populations. The dentist now is much more friendly a place to come. If you're concerned about something, go and see a dentist. If they're not unsure, they will then send you on to see someone that will be able to get it checked out for you.